before I tell them about this horrible procedure because, oh, I'm sorry, I got you all upset. It's not you, it's the guy over there. You're going to do what? And no, oh, okay, all right. So, ID, I'm so-and-so, I'm going to be your nurse today, and you are, okay, good, you're the right person. And doc, you know, we have an order for a catheterization. What that is, because to say a catheterization means nothing if I don't understand what you're talking about. That's not informed consent. I have to understand it. It's catheterization. It's just going to be a tube that's going to go up into the bladder, helps drain the urine. It's going to be in there just temporarily, or it's going to be in there probably till you get ready to go home. Keep it simple. Don't do a lot of talking. You usually bury yourself when you do that. They've said yes, everything's checking out. Do you have any allergies to latex? What are the others we just talked about?
Fish.
Okay. I'm just going to check you to see if you need any cleaning before we get started. Okay, pericare, all right. Verbalize, well, I am checking the perineum. I'm also going to see if I can visualize the meatus, all right. So I'm getting them positioned. The draping you're not doing, right?
No.
Okay. Was it even demoed or taught at some point?
Mm-hmm.
Let's get this patient flat. Because we would have a drape on that keeps them covered, but the drape is also nice. It gives them a feeling that they're not being exposed, even though the most intimate part of their body is. But it's also good to keep them warm, okay? So it's good psychologically for people who are more private, okay? That aren't native Californians where we going around showing everything, right? Okay, so we've given our space. Notice how I kind of angled her to give myself space to glove over here, all right? I got to get myself, I've been demoing third semester all morning, so I got to remember, you guys have the table.
Valerie?
All right.
So when you glove on the bed, does this have to be waist level too, since it's sterile?
Ish. Yeah. Yeah. Remember, kind of waist level is a little relative too, right? Because I can just. So, because you're going to want this at a comfortable height for you to be working. All right, you don't want to be leaning over. So even a little bit higher could be better. All right. For me. Okay, and that's good. All right. So let me think. Okay, you guys are over here. All right. These are my utility gloves that I would use if I'm going to do any pericare. If I'm going to do pericare, all right. I'm going to take it after I take my gloves off. I'm going to wash my hands again. All right. Okay.
When you go to wash your hands, would you lower the bed?
Yeah, you know, you've got your side rails up, so you're good. I would say it kind of depends on the distance. If I've got a sink right here, I'm good. But if I had to go on another side of where I couldn't see the patient or go a distance from the patient, the general rule is this: if you have to go beyond the bed, get them back, okay? But I would say, depending on the alert, any disoriented patient, any patient that's had a stroke or any part of their body where they don't have sensation or good control, okay? Because what can happen, that limb falls and the rest of the body can come with it. So anything like that puts a patient at a higher risk. But they're laying flat on their back. Most patients are going to stay pretty stable. Okay. All right. So we can keep them covered for a little bit until we get. Check your equipment. What do I want to verbalize here? Expiration date.
Intact, no torn, no wear tear.
Intact, those tours get in your, they create trouble every time. Watch those tours. And so, exactly, moisture, and then my service, clean, dry, flat, right? Okay. So, and also the contents. right, we failed to say that. But what are the contents? Every kid's maybe going to be a little bit different. Does it have the Foley in it? Or do I get the Foley separate? All right? Is this the Foley size that I want? Maybe the doctor called out it's a turf. So I need a big 30 cc balloon and a very different size or kind of cath. So check your contents. See, is that what I want? All right? Things look good. Again, no pores, no moisture. We're good to go. So let's see. You guys are discarding over here, so we'll use that as a nice little barrier for discard. Now, what I want you to think about here, there's a lot of confusion about this 1 inch. I don't want to see you touching any of it. All right? Don't need to. Pull from the back, pull from the underside. I'm not touching any of it. Okay? If something is sterile, I can't touch it. If I touch it, I have planted my bacteria on it. It's no longer sterile. Okay? So depending on what the situation, what the procedure is, but I want this to stay sterile, I'm not going to touch the top of that. All right? Okay. So, who did this to me? Because this isn't the way this... Who packed it? Okay. So these will also have dog ears, all right? And they're dog-eared for a reason. Not so that you can go like this and pick it up and nick it as you're picking it up. But the shiny side is folded in so that I can approach it like this, lift it, and I've touched the back side, which is going to go down, which is not a problem because it's the side that's going to go on the bed. So I can pinch up, and float it in. Okay. This is the drape for what?
The male.
The male. I don't have a male. Okay? So I can grab it and put it over here. All right?
Yeah.
All right. Now, picking up the gloves. When you pick up the gloves, I don't want to see anybody go like this or try to. Try and go right in and see what pops up. Grab what pops up. Get the rest of your hand in there to help support it. Don't go like this. Oh, oh. All right, and they fall out on the way. So, it's okay. Remember, the whole outside of this is going to be contaminated when it goes down on your surface, right? I can touch it. So, we're getting into thinking less about rules, integrating them. Okay? A knowledge, an awareness. What is okay? So touch it. Yes, I can touch that. It's safe to touch it. Yes, it's safe to touch that. Yeah, because I'm going to be setting this down. So think this through and start integrating the rules into a real knowledge and awareness that is your basis. Okay? All right, so now we don't want to turn our back on this sterile field. So we don't want to be over here doing this. So you're just going to set the package down, keep this up, keep that in your sight, because all I'm going to do is pull up one glove at a time, okay? Turn to the side and put the glove on. Pack my own stuff from these. So when you test, powder the gloves. Make sure the gloves are good. Never trust another person's box. Not when you're going to go test. Don't risk it. Again, this is a prior learned skill. You got more risk. You got more to lose failing it. It's not as cushy as it was the first time because failing a prior learned skill is going to be a progress note. Don't risk it. Okay? Okay. Everybody's gloves should go on with a long If you don't know how to glove well, if I haven't done gloving demo with you, you should all be like this. None of you should be like this. If you are, you weren't taught how to properly glove. And look at the disadvantage I'm at right now because I can't cross in. But when I've got a nice, long, professional, properly gloved, like I was here, look at how far I can reach now. All right? So if you're not doing this, you need to see me about how to glove. All right, now it's easy. I'm sterile. Everything I touch is going to be sterile. I've got room to even cross a little bit. All right? So depending on your package, if you've got these, all you're doing here is tearing this one open and taking them out. Okay? Hover and drop. Okay, what I call the helicopter hover. All right? Don't go set, because that's when you guys make mistakes. Okay? You don't have to pick something up until you're going to use it. So I don't like to see you pick this up just to take the cap off to set it back down. It's a wasted move. Streamline some of these moves. All right, don't pick it up until you're ready to use it. You've got let's do your KY. You might get a kit like this. Open it. Okay, squeeze it all out. You might get a kit with KY in a tube like this. Don't let that confuse you. If you do, you're just going to pick it up. You're going to squeeze it out. Okay, hover, drop. This is our water, I think. Yeah, for this guy. He had a cap on. All right. This is missing the sheath. You would have a pulley out with a sheath on the... Did you guys have the sheath out here?
No, it wasn't on there to begin with.
Do you have a sheath I can borrow just real quick from your colleague?